So indeed, Dutta Gupta with the Georgetown Center on Poverty and Inequality. I'm looking forward to hearing from you. But for starters, I was hoping you could give us a little sense of what the Georgetown Center is. I mean, what's the kind of scope of research that you do?
Absolutely, Chris. I'm joined by my 4-year-old here. Okay. The Georgetown Center on Poverty and Inequality focuses on research and analysis to develop ideas, policies, programs, practices, and systems change that would reduce poverty and economic inequality in the United States, with a particular focus on racial and gender equity. So we've worked on paid leave from a number of angles, including with focus on disability and thinking about what equitable national policy might look like. And if I can just say that one of the things that's quite clear from listening to Wendy is that at some point in all of our lives, we're likely to need to take time away from a job to address our loved one or our own illness, or welcome a new child into our family. And if nothing else, we were obviously all once in need of care, and likely will be again. And Wendy pointed out that we do have something, some national policy with the FFCRA, but in the midst of this sort of devastating crisis, or series of crises, really, we have more people and leaders, whether in Colorado or Washington, D.C., recognizing the need and benefits for creating a paid family medical leave program that would really get the job done and help families right now, but going forward as well. I think it's also important to think about paid leave as an opportunity to reduce economic and racial inequities, as we'll discuss. So you can see on the next slide, I'm really going to focus on just 2 main points and then talk a little about what's next. The first point is that the pandemic and crisis have illuminated and increased the need for paid family and medical leave. The second is, I'll talk a little about research suggesting that comprehensive and inclusive paid leave along the lines of what Wendy discussed can reduce inequity and improve well-being. And when I sort of close by talking about what's next for paid leave, I'll mostly tee up some questions that I think are worth folks in this session in the audience thinking about and asking. And if we have time, we can discuss some of them later. But let's jump in on the next slide. As Wendy pointed out, the need for caregiving, sorry, on the next slide, at least I can't see it here, but the need for caregiving is quite universal. And BLS, the Bureau of Labor Statistics, estimated that more than 40 million people provided unpaid informal care to an older adult between 2017 and 2018. So that's not folks who are in, say, long-term care facilities, which have gotten a lot of attention, of course, because of the pandemic. And then data analyses from many years ago, but sort of the most recent available from the Family and Medical Leave Act, which offers unpaid leave, suggests that a majority of workers, about 55%, took leave to care for their own illness, but over a fifth took leave to welcome a new child, and almost a fifth took leave to care for a parent, spouse, or child. And in 2015, we have again estimates of more, that 40 million figure is even higher when you add in the number of folks who had to take provide unpaid care for a child, and you get up to nearly 44 million. And then, of course, as we know from Wendy's talk, that with not just with the pandemic, but with aging of the population, we expect family caregiving needs to rise. And we also are seeing that workers who are most affected by the pandemic, especially Black and Latinx workers, there's just less data often on Alaskan Native and American Indian workers, but are particularly unlikely to hold jobs with the benefits that can provide them the leave and other benefits they need. So I just want to jump to making this point about how paid leave improves health and long-term outcomes for individuals and families. We've got a lot of evidence of it improving physical and mental health for parents across the world, but even in the US context, but other caregivers as well, and that it improves child health and development outcomes, results in much higher breastfeeding rates and longer durations of breastfeeding, particularly for women with lower incomes, higher vaccination rates. You can imagine it allows parents to spend more time with parents and navigate our health system and the like, and decreased rates of infant mortality, as well as low birth weight and preterm birth. The other area where I think there's a lot of evidence is that paid leave improves labor market attachment and long-term labor force participation, promoting higher wages, largely for women, and in some cases for both part-time and full-time workers, especially at when we think about the programs that are being proposed and already in place in the United States, that we would expect these sorts of positive effects. And then, a final point here is that paid leave quite clearly reduces poverty, especially if it's well designed and promotes economic security. We have evidence of this from the longstanding California program, where we saw significant reductions in poverty. Household income increased also meaningfully from analysis looking at the program from 2004 to 2013, and that it really filled a gap among working women who didn't have access to employer-based paid leave. Now, on the next slide, I want to talk a little about how paid leave really does support all of us. There's research suggesting it improves job retention for lower and higher paid workers, that it leads to improved morale, reduces employee stress, and that, again, that this might, some of these benefits might even be particularly concentrated among workers of color and women and others who have unstable, unpredictable schedules. But also, paid leave truly does boost the economy. I mean, this is one of those policies that can increase equity and efficiency. Right now, there's evidence that lack of a national paid leave policy is contributing substantially to gender disparities, racial wealth gap, and cost the economy tens of billions, potentially now over 100 billion a year, based on analyses from 7 years ago or so. But we also know that because it can improve women's labor force participation, it can boost our economy. A 1 percentage increase in 1 percentage point increase in the workforce can boost total national income by 1%. That's approximately $180 billion a year. And so more broadly, when you look at what's happened over the last half century and where the economy and when the economy has done particularly well, a good chunk of that can be attributed to the growth of women's labor force participation. Right now, we've unfortunately gone backwards on that front. And some research suggests that when compared to other countries, the sort of relatively lower female labor force participation rate change from 1990 to 2010 in the US was likely due to a broad lack of family-friendly policies, including paid leave. On the next slide, let's just talk a little further about COVID-19, how it's increased the need for paid leave. Wendy, you covered a lot of this. So I'll just add that we have to remember that the baseline here is very limited wealth, especially for Black and Latinx families and households, about 1/10 that of a typical white household, and then about 1/5 the liquid wealth of white households for Black and Latinx families. So there's not much of a buffer there, right? So the idea that people can go without a paycheck for a week, 2 weeks, it's even if it were true for the median household, it's even less true for certain communities of color. And of course, children and families in poverty have been facing some serious hardships, which actually appear to be growing in recent weeks based on the Census Household Pulse Survey. We've seen hunger or food insecurity rates actually rising in the last few weeks. And I mentioned that women, between the childcare crisis, multiple rounds of layoffs, including public sector ones that disproportionately affect women, and service sector jobs that have disproportionately affected women, they've been particularly harmed in this recession. And caregiving has been a major reason why. There are estimates that we need at least $50+ billion in emergency relief just to stabilize the childcare sector. We've seen childcare providers close throughout the country permanently. So that's a major challenge right now. On the next slide, I just want to emphasize again some of what we've heard. We'll talk about the sort of way that paid leave policies can be designed to reduce inequities and improve well-being. And you'll see on the next slide, really these broad principles are, I think, ones that a wide range of policymakers can get behind. There's obviously a lot of disagreement about other issues, but these are the basic goals of what paid leave is intended to accomplish, which is allowing all workers to provide the needed care, the care they need for themselves and their families, support better health and child development outcomes for individuals and their families, and of course, ensuring financial stability. But note, we can do that also for employers as well. And what does the research tell us here? That we need to be very careful about things like Social Security number requirements, which can leave out lots of tax-paying households, lawful residents, and others from important caregiving here. We should think about the high wage replacement rate. Wendy talked about how states have learned, and you can have a progressive wage replacement rate that approaches or even reaches 100% for some of the lowest paid workers. As we've seen with unemployment insurance during this crisis, unemployment benefits now are routinely inadequate to keep a person above the poverty line in many states. And then, we think that there's a lot that one would want to do along with the benefits. Of course, Wendy mentioned job protection and the duration, lots of evidence of promoting positive outcomes, but also think about combating workplace discrimination and allowing, especially for people with disabilities, more intermittent and incremental leave. And there are ways that can happen without overburdening employers. And there's a lot of debate now. We can talk about sort of what the right structure is. What we've seen across states is the social insurance model with payroll tax financing. There may be other models. I think we've seen other proposals in Congress that I think are arguably ill-suited for the goals. For example, some people have suggested basing it off the UI system, unemployment insurance, something I've worked on for over a decade, and the unemployment insurance system itself has struggled. There's been the use of tax credits, of course, in the FFCRA and other proposals. But when you look at the timing of the payments and sort of other details, there are some real problems with those approaches, even some proposals that borrow against other future benefits. And so we could talk more about that. But let me just kind of highlight on the next slide what's next, and really looking at President-elect Biden's proposals, both for the campaign, which is to endorse the two pieces of legislation in some form or another. Wendy mentioned, I think that there's also an important point we'll talk about related to financing with the Family Act. And again, you'll see on the transition side that there's been re-emphasis on essentially some variant of the Family Act and the 12 weeks of paid leave. So on the next slide, when I think about what's ahead, you can see there's a question, of course, the very timely one about what to do about the FFCRA leave. And it's not as though policymakers haven't attempted to answer that, including the HEROES Act and HEROES 2. There's a question about a version of the Family Act advancing in Congress. This might, of course, depend on whether which party has the majority after the Georgia runoff elections. And then, of course, the Biden campaign has been quite clear that they do not intend to raise taxes on households below $400,000 a year, which makes a payroll tax only financing approach virtually impossible. But then there's also a question, again, depending in part on the electoral outcomes, about what the administration might be able to do unilaterally, including for federal contractors and federal employees, but also potentially laying the groundwork for legislative change down the road. And then, there'll continue to be a push at, the state level as well. So with that, thank you, and I look forward to taking questions.